Thank you for taking the time to view this virtual podium presentation. This research is entitled Older Adult Suicides in Clark County, Nevada between 2017 and 2021, Trends and Potential Impact of the COVID-19 Pandemic. My name is Catherine Gaddis, and I am a PhD student in the Department of Anthropology here at the University of Nevada, Las Vegas. I completed this research under the guidance of my advisor, Dr. Jennifer Burns. The World Health Organization points out that the quality of currently available data regarding suicide attempts and completions is relatively poor. This is true of most mortality data, but because suicide is a particularly socially stigmatized topic, it is highly susceptible to misclassification bias and underreporting. It is therefore important that we build upon the available data to better understand trends in suicide deaths worldwide. According to the CDC, suicide rates have increased by about 33% over the last 20 years. At least 47,500 people died by suicide in the United States in 2019, and many more considered or attempted suicide. According to the American Foundation for Suicide Prevention, suicide is currently the 10th leading cause of death in the United States, and according to the CDC, in 2019, suicide was the 8th leading cause of death in the state of Nevada. Based on data obtained from the Clark County Office of the Coroner and Medical Examiner, suicides constituted 13% of all deaths processed between 2017 and 2021. We chose to focus our research on older adult suicides specifically. This is because older adults are typically underrepresented in forensic science research. However, they constitute a significant portion of the population, and it is important to consider their unique needs and experiences. Furthermore, I wanted to explore the potential impact that the ongoing COVID-19 pandemic may be having on suicide rates and trends among older adults using Clark County, Nevada as a sample group. While suicide is an important public health problem at all ages, an article by Van Orden and Deming summed up the particular challenges associated with suicide among the elderly rather nicely. Number one, the elderly population is rapidly growing as people begin to live longer, and number two, elderly suicide tends to attract less attention. Risk factors that are particularly relevant to older adults include perceived burdensomeness, poverty, acute psychiatric and/or medical illness, perceived hopelessness or worthlessness, social isolation, perceived stress, and potentially cognitive impairments related to old age. And while they may attempt suicide less often than younger adults, older adults are more likely to experience a fatal first suicide attempt than younger individuals. With that in mind, we can discuss the specific research questions that I had when approaching the topic. My primary research question was, did the COVID-19 pandemic impact rates and trends of older adult suicides in Clark County, Nevada, and, if so, how? We hypothesized that, yes, there would be an impact. We expected to see an increase in rates of older adult suicides and geriatric suicides in particular. I thought that the increased social isolation and stress associated with the pandemic would contribute to an increased suicide rate among this demographic. We also expected to see changes in trends regarding the cause of death involved in suicide deaths. So I'd like to start off by giving a brief overview of the study sample, followed by general findings from the dataset as a whole. After this, we can jump into our results, which examine observed trends following the COVID-19 pandemic. The data utilized in this research was obtained from the Clark County Office of the Coroner and Medical Examiner's CME database. Adults over the age of 50 who, per CME reports, died by suicide in Clark County, Nevada between March 12, 2017 and March 11, 2021 were included in the study sample. Adults for whom neither an autopsy nor investigation report could be obtained were excluded. In the end, a total of 897 individuals were included, of which 77% were male and 23% were female. The sample was divided into two age groups. We chose to include adults over the age of 50 because typically when working with human skeletal remains, anthropologists define adults estimated to be 50 years and older as older adults. However, we also wanted specific information on geriatric adults, and clinically the definition of geriatric is 65 and older. So we have a 50 to 64-year-old older adult group and a geriatric 65 and older group. In making this age distinction, we hope this research will be applicable in both anthropological and clinical contexts. About 54% of the sample fell into the older adult group, and about 46% fell into the geriatric group. By race, the majority of individuals included in the study were Caucasian, followed by Hispanic, Black, and Asian individuals. Now we can discuss the most common causes of death. The CDC reported that, in 2019, the most common mechanisms for death by suicide included firearms, suffocation, and drug poisonings. It's important to note that access to lethal means is a particularly important risk factor for the elderly, and according to the Clark County government website, as of 2021, more than 45% of households in this region owned a firearm. We see this reflected in the cause of death data obtained for the study sample. The majority of individuals died by firearm, followed by drug and/or alcohol intoxication, suffocation, and blunt force trauma. Breaking this information down further, the two age groups were both more likely to die by firearm than any other cause, but the geriatric age group was nearly twice as likely to die by drug and/or alcohol intoxication than they were by suffocation. Furthermore, females in general were more likely to die by drug or alcohol intoxication than by firearm, whereas men were more likely to die by firearm or suffocation than they were by drug and/or alcohol intoxication. For the purposes of this project, the beginning of the pandemic was considered to be March 12, 2020. This is because Nevada Governor Sisolak issued the first declaration of emergency stay-at-home order on the state. As mentioned previously, the time period used to derive this sample was from March 12, 2017 to March 11, 2021. This provided us with 3 full years of data prior to the chosen pandemic start date. And as you can see, cases were mostly evenly distributed over the 4 years. There were some notable changes related to cause of death between the pandemic and pre-pandemic periods. Firearm deaths related to the total number of deaths increased significantly in the pandemic period by about 11% as compared to the pre-pandemic period. Drug and alcohol intoxication related deaths decreased significantly from approximately 19% to approximately 11%. So, in conclusion, overall, minor changes were observed between the two time periods. There was a slight increase in the percentage of geriatric deaths between the pre-pandemic and pandemic time periods, but this was not a statistical difference. Furthermore, the majority of individuals who died during both time periods were male. The most notable differences observed were related to cause of death. The percentage of firearm deaths increased by about 11% again. We suspect that this may be related to people having more prolonged access to firearms kept in the home during quarantine when they might usually be in their homes less often. Similarly, the decrease in drug and alcohol-related deaths may be related to limited access to these substances during the pandemic lockdown period. Moving forward, we would like to broaden this research to include other forms of violent death among the elderly as well, including accidental deaths and homicides. The CDC states that, contrary to expectations, deaths by suicide dropped by about 3% overall among all age categories in the United States between 2019 and 2020. However, their data analysis is ongoing, as it's difficult to pinpoint the specifics. It's possible that some demographic groups may have been differentially affected. Suicide rates may have increased for some groups and decreased for others. That's partially why we wanted to focus on older adults in particular, to get a better sense of the impact of the COVID-19 pandemic on this specific population group. Many studies emphasize the need for multidisciplinary collaboration when addressing the issue of suicide prevention among geriatric patients. By studying rates and trends of suicide and other forms of violent death among older adults, we begin to better understand the specific challenges experienced by this demographic, and, in doing so, we'll be better able to develop effective prevention strategies. And with that, that concludes my presentation. Thank you so much for your attention. I appreciate it. And that's it. Thank you.